well. I went in there, and I had a questionable rash all over my body. Wasn't really sure what it was. They didn't know what it was either, so they took some blood work. They came back. They were testing for like mono. It came back negative. And then the doctor told me it was either one, a script virus, which they didn't know what it was, or two, it was strep throat that had gone undetected. She said if the rash got worse, to come back and call her the next day. Got worse, went back the next day, and she gave me a prescription that I had to take. Supposedly clear it all up. Took the prescription, and it made me like deathly ill, like completely sick, couldn't go to school, whatever. Went back to Hudson, did another blood test and more blood work. Still didn't know what it was, but then they're like, well, maybe it's strep throat that went undetected. So they prescribed me another medication in case it was strep throat. And turns out 2 days later that they said, oh, I did have strep throat, and I'm spending $60 on prescriptions for something that I could have just diagnosed in the first place. So that's what happened. I mean, yeah, Hudson's not the top of the line healthcare, obviously. I feel that like the doctor should have known what it was. Like, I mean, strep throats. I mean, I know it had gone undetected or whatever, but if I had like a rash all over my body, like, I feel like it should have been caught because my aunt looked at it. Like, she's a registered nurse. Like, she knew exactly. Like, my mom had called her. Like, she knew exactly what it was. She's like, strep throat went undetected. Like, and they never like gave me a straight. Like, they thought it was mono at first. Like, I never even heard of like a mono case having like a rash.
Oh, okay. My friend went to Hudson, and the nurse took her into the room before her appointment and asked her if she was allergic to anything. She said she was allergic to penicillin, and then the antibiotic they ended up giving her had penicillin in it. She didn't know though. So she took it, she got a rash on her arm, her throat started to close up, so she calls Hudson the next day, she tells them the story, and she told them she was allergic to penicillin. They started freaking out, oh, well your antibiotic has penicillin in it. And they gave her a steroid, and then they charged her for the steroid. So then her parents had to call Hudson. It's just a big, huge deal.
Um, I mean, I think that's ridiculous. But that money's like set aside for Hudson, which was supposed to like better the health clinic, which obviously like they're I mean, I work at Hudson. They're understaffed right now, and people like aren't pleased. And like if you can't like properly staff a facility, then how do you expect to like make it run? Like that money was supposed to like go for a new like technology, hiring people, like building, and for it to be used for athletics, I think that's just like honestly ridiculous when they have already had their budget. And the only reason they're taking money from like Hudson was because they're in debt so much. So
No, that's absurd. Like you don't need you don't need like to have an athletic department is not what makes a school. You have 20,000 kids on campus, and their safety and their health should be the main focus, not these athletes that don't even do a good job anyways.
Well, I think that it's really stupid. I think that our athletic department has enough money and that it's prospering without the extra money taken from our medical facilities. So I think that with all the stories I've heard about Hudson and about the complications that people have had in Hudson, that the money needs to go back to our medical facilities in order to enhance those and improve them.
I know the few times that I've been to Hudson, it hasn't been the best experience. I haven't had any specific problems, but I feel like with taking more money out that we could have been using to get better services at Hudson, now he's putting it in the athletic department, that's just not a good idea. It's probably going to become even worse for students at Hudson, and the money's not going to be used for something good.